welcome back to the Nursing Now podcast. My name is Janelle McSwiggan, and I'll be your host. I am super jazzed about this episode. We're going to be talking about transitioning from the bedside to remote and the different ways that you can decide to do that. So we're going to be diving in an introductory way to the different areas of remote work for nurses, and we're going to be going a little bit deeper than we have in the past. Now, all of these different areas that I'm going to be talking about will have their own episodes, but I'm going to be introducing the topic so you can start to get used to the ideas, and that when you see a future topic, so we're going to start by introducing remote work and why are we starting to see a tick in remote work now, and where was this about 10 years ago? Why is now so special for remote work? And I think no one's surprised to hear that COVID really changed the landscape for nurses and jobs everywhere. So COVID introduced burnout like nothing else for nurses. It was definitely the hardest time for me and so many of my peers that I've heard of to date. We dealt with insane work schedules, reduced supplies, uncertainty, the anxiety, depression, and burnout rates skyrocketed through the roof. Nurses left the fields like nothing we've ever seen before. And it deepened the nursing shortage in a way that we hadn't expected. And that continues to shape the landing today. And that continues to shape the landscape today for nurses. We're still dealing with the ramifications. The shortage is just getting worse and worse. And that's led to people starting to transition further away from the bedside to seek out other roles where they're not burnt out and that the nursing shortage isn't quite affecting them in the same ramifications that they are when they're physically touching a patient. While some nurses made out really big in COVID, other nurses were left behind. And they're starting to figure out ways that they can get ahead. Other nurses that didn't get ahead felt like they saw through the shrouded veil. They saw that they were just another cog in the machine and that their lives really didn't matter, that they were absolutely disposable. We all know that we're essential workers and that we were called to do our jobs, but what we weren't expecting was reusing PPEs, hearing stories of people using plastic bags because they didn't have the appropriate measures to keep themselves safe. I didn't expect that we were going to be reusing things and that I would go to the supply closet and nothing would be there, that I would be forced to come in sick and my peers come in sick as well, that I would know personally nurses that died from COVID, and that all those factors would weigh so heavily on me and just really drive home the point that I didn't matter. My safety doesn't matter. The only thing that matters to these large corporations are hitting their numbers and patient-centered care. I invite you to think about nursing-centered care, because patients aren't the only people in this hierarchy of needs. We still matter. So COVID brought our attention to the possibility of working remote in other industries. While we were essential workers working on the front line, other people got to stay home, and they figured out the comfort of their home was a great place to work. I watched my friends thrive in their remote offices, and a lot of nurses started to think that we could do the same. At this time, it really widened the gap between nursing, a predominantly in-person discipline, and other disciplines like tech, engineering, and finances who really supported at-home work. So there's been a push for more remote options for nurses who are curious. So there are alternative ways for our licenses that we can still support our community and our patients. We can have an active nursing license while working in alternative careers, still using our license. We are still nurses. We're just not clinical bedside nurses at this time. And if we decide that it's not for us, we can always go back to clinical bedside work. There's nothing chaining us or stopping us from going back. Lord knows the nursing shortage is not getting stopped anytime soon, especially because new nurses are figuring out how little their freedom is when they're at the clinical bedside. Fewer and fewer people are entering nursing, and more people are finding other careers that better suit their mental health. So the nursing shortage is just getting worse. And if you're worried about losing your bedside job for a remote work job, you can always go back. I support nurses as they transition away from the bedside. So I have a course and also do intensive mentorship programs. And I've worked with new moms that can stay home with their babies because they're supporting their families with remote work. Parents that can be at soccer games. And frankly, kids that don't have to miss out on Christmas or major holidays. You have the freedom to work wherever as a remote worker, as long as you're working within your license. And some specialties even let you pick your own hours. So you don't have to miss doctor's appointments. You can go early if your kid's sick at school and pick up, or you can hop in the pool in the summer. Like I said, you don't have to use your children as an excuse to do something. You can find happiness and support your own happiness. Finding remote work can also reinvigorate nursing for you. I don't know about you, but I started to get disenfranchised. I've said it before, but this was not the nursing that I expected. I really thought I was making a difference. And to see so many of my patients die during COVID and to realize that I didn't matter, that my bosses didn't care if I got sick. They didn't care if I was reusing equipment or if I didn't have equipment. They only cared about the reimbursement rates. It was really, really disheartening. So finding a new area was really reinvigorating. Using your license in a new, fun way was fun. Learning something helped me get out of the rut and learn something new. I was respected in a new area. And if you're a nurse, you have tons of transferable skills to dive into those new areas. I've talked about this in the latest podcast, so I'm not going to go that far into it. But we're great at recognizing subtle trends, seeing that big picture. We're amazing, clear communicators. We have to work well within a team. We have to concisely understand things. Our prioritization is top notch. We know exactly what we need to do, when we need to do it. We meet our deadlines. We're amazing, accurate researchers. Our communication is empathetic, and we're field experts. We have an in-depth understanding of clinical topics that other people can't. We've lived it, we've breathed it, we've talked to these patients when they're at the bedside. The best other journalists can do and other people can do in general is just research. But we've spent hours living this. So we're at a really unique perspective here. So we're going to be going into the different remote nursing roles that you can start to pursue. Like I said, everyone will get a different episode, so this is just an introduction to get you used to it. So the first one is legal nurse consultant. I'm going to abbreviate this to LNC, and you'll see this abbreviation used over and over again, LNC. So LNC is a nurse who uses their medical and legal knowledge to advise attorneys on healthcare-related cases. So they have a ton of different responsibilities. It varies case by case, but pretty much you're working closely with a lawyer or a firm because lawyers don't have the medical background. They're not field experts, but they're experts in law. So we provide that background information so they can make their educated decisions in their scope while we stay within our scope. So LNCs might review and analyze medical records because they're all in jargon, the nursing notes, and we're going down and we're providing context. Was this medication administered at the right time? Were there any mistakes here? Were they acting, was the nurse that was documenting acting correctly within her scope? We advise, or LNCs advise attorneys on health-related cases, and we pass professional judgment on medical cases for them, because like I said, they don't understand. They can also act as medical witnesses during trials, which is super interesting. So again, you're always providing that context to the legal team, which they don't understand. We identify the patient needs, so they might identify how a patient should have been cared for and decide whether that nurse or medical doctor received or gave appropriate care. They take inventory of all the evidence and see if anything's lacking. They can prepare documentation for the lawyer, pulling out what's important. They can also hold patient interviews and sit in on patient interviews to gain more information about the care that the patient received. And they can also do additional research. They know everything that's been given. They don't know everything that's been given. Fucking edit that out. They can also help estimate the cost of care and damages if there are any for that. So they may help with the legal team determine the overall cost of care or what the cost of damages were related to that care. So LNCs don't have an official accreditation body, which is really interesting because this is a very hot field. I know a lot of LNCs. There are a bunch of different courses you can take with different certifications, and because there's no accrediting body, they're all made differently, so you really need to vet them and figure out which one might be the best one for you. That being said, you don't need a certification to start, but it does help build your authority. You typically start by shadowing a more established LNC. A lot of the time their caseloads can be really, really dense, so they might bring on a newer LNC to help them review cases. A lot of the time it's a lot of reading through nursing notes, reading through clinical documentations, and pulling out these small clues that the patient might not have been cared for. So it's really, really meticulous, which is why they might need a novel LNC to come on, which is very beneficial for you because that's how you can get started. The next remote role that we're going to briefly go into is medical writing. So we did cover this in the previous episode, so we're not going to go very deep into this, but if this is the first time hearing me, this is a really good introduction into medical writing. And for background, I am a medical writer. So medical writers write, research, and edit health or medical content. It can be written on print or the web. There isn't a certification by a governing body that you need. There is the American Medical Writing Association. They do have a certification, but honestly, it doesn't hold a ton of weight. I'm not accredited, has never stopped me. You also need years of experience before you can even get the accreditation, and it has to be full-time experience, so if you're a freelance writer, it might be a little bit tough for you. I think nurses really obsess on our credentials, so you don't really need to get the certificate. So it is an entry-level job for nurses, as is LNC. LNC is also an entry-level job for nurses, so that means you can start it right away. So if your clients are international, the AMWA, the American Medical Writing Association, won't cover that type of writing. So I have international writing clients, and it doesn't matter to them that I have the AMWA certification or not, because nothing carries over if your client is working in the Australian space or the Asian space or the European space, because they all have different ways of writing and different styles. So a nurse writer writes articles, education materials, research papers, patient education materials, textbooks and marketing materials, and so much more. They might write proposals, research grants. They can also do fact checking. So that means that we're going over every piece of information in that article and figuring out if it's true or false and where the research is pulled from and if that research is biased or sound. A close companion to medical writing is also medical editing. Medical writers edit their content before submitting it to a medical editor. So you do a little bit of editing your own work, and then you also pass it off to an actual medical editor for that specific role. And they'll review it for grammar, for cadence, for spelling, and to the style guide. Nurse writers, a lot of the time, can also be consultants. So we might team up with a TV show to figure out how nurses are portrayed in that TV show and if that's accurate, that type of thing. So there are a lot of different ways that you can get into medical writing, and there's a lot of different facets within medical writing. So I like to say it's a great field to go into because it's so broad. Another role for remote nursing is telehealth triage nursing. So being a remote triage nurse involves assessing patients' medical conditions from a remote location, usually from home, using digital communication tools. This means that you need to have a strong medical knowledge and the ability to make critical decisions about patient care. So this really marries the concept of remote work with clinical care. If you're not totally ready to leave the bedside, if you're just looking for a little bit of a lighter role, this might be perfect for you because medical writing really does let go of that clinical work. LNC, you're still using that clinical knowledge because you're really looking at the documentation, the nursing notes, the medication administration and treatment plans to see if they were working within their scope. But triaging is a really good way to still stay sharp if that's something that you're interested in. So, as a triage nurse, you're answering patient questions, offering medical advice within your scope, and determining the urgency and appropriate course of action based on the information that you have. You have the opportunity to build relationships with some of these patients, especially if you're working with a primary care area, and you're a key part of the patient's care team. You communicate directly with the providers and in-person or in-office staff to let them know what's coming their way and what their caseload really is. So you're still working within a team. So if you're worried about being remote and not really having that peer-to-peer connection, this would be a really great option for you. You're using your own expertise in following the provider's care plan to support those patients as well. So you don't need a specific certification or degree for this outside of your nursing degree, but the basic requirements are you want to have at least a few years of being a nurse. You need to really understand your clinical knowledge. I wouldn't really recommend it for people that are straight out of nursing school. You do need to have that clinical background. Usually they prefer 3 to 5 years. I have seen as few as 1 year of clinical background, but it is pretty rare. Primary care nursing is usually preferred because that's the type of triaging that you're really going to be doing is primary care. And experience in the specialty that you're triaging is a must. So if you're an oncology telehealth triage nurse, you need 3 to 5 experiences in oncology, preferably. And if you have primary care, that's even better. You also need to be really confident in your clinical judgment because you won't actually be seeing the patient. So you need to know how to make those judgment calls. If you are a really nervous nurse at the bedside and you weren't quite sure of what you were doing, this might not be the best role for you. You might really second guess yourself. There are decision-making trees to really help you here, but you do have to be confident. You also have to be really good in active listening and communicating effectively, both with the provider side as well as the patient. You need to know the questions to ask as well as deciphering what the patient is saying, because you're really going based off of them and pulling out that information because you can't touch the patient, right? So you need to be using other areas of information. The next remote role for nursing is admissions nurses. So a lot of the time these are in-person roles, but you can also do remote discharge and remote admissions. So these nurses are responsible for discharge and admission care coordination, case management, and like teaching and counseling for these people. So it's very similar to case management, and you're determining the case complexity and referring to departments when necessary. You're determining care coordination, what they might need, and figuring out counseling and identifications of treatment options for them. This might be good as well if you're more of like a clinical nurse that doesn't quite want to let go of the bedside completely, but you also enjoy that overarching theme of advocating for your patients, making sure they get what they want. Admission role might be for you. You consult with the extended team of physicians, providers, and other members, including maybe dietitians, to get them resources for your patient. That might be maybe like a food truck or PT, OT services, and you're just outreaching on behalf of that patient for you. And that might also include counselors as well. You're also doing medication safety, so reconciling any medication, monitoring for adherence, and education. Once again, more of like a clinical role if you're interested in that. You're implementing the care plan for the provider who may not be available, and you're overall just offering support for your patient. So again, there's no real certification for this. They really just want 1 year of maybe health insurance or managed care, because some of it is regulatory information that you need to know. If you know like medical management policies and procedures, that's a really good one. If you have information on admissions or discharges, that's a really good one too. So the next remote nursing role for nurses actually ties into that, and this is case manager. So a case manager is a remote nurse case coordinator that helps patient care for patients with chronic or more serious conditions. So these are the people that might have multiple comorbidities and they just need more support overall. So you're there to coordinate that. You might create care plans, advocate for patients, schedule appointments for them, communicate with patients and the families as well as their doctors. You're educating the patients on their disease processes, and you're also the middleman for insurance providers to really help them, as well as maybe nurses in the school or any other specialty. You're collaborating with healthcare providers to let them know what your patient needs, and this might include social workers as well as supply managers to make sure that they have the supplies that they need to thrive as well. You're making sure that the treatment is working and reporting back to the doctor if it isn't, and we're making adjustments to that treatment plan as needed. So again, this is a little bit more clinical, but it's also more of like a management type of overarching thing. So if you're into that big picture, this might be for you. Remote nurse case managers work primarily from home using like phone or the internet, and it's usually the day shift. So their work schedule is more similar to office hours than it is to healthcare workers. So that might be better if you're trying to sync in with the rest of your family, you have kids in school, or you just want to hang out with your friends on the weekend at night and you don't want to work evenings. Remember, you don't need kids to justify this type of lifestyle. You are valid in your own needs. So there is certifications for case managers. This is one that does have certifications, and there are several different certifications for case managers, especially for nurses. So the ANCC offers one. There's a complex care one. Most certifications require hours or you already working in the role. So it is possible to get a job without a certification, but they do prefer you have one or that you're open to getting one within like a couple of years of working for them. I was doing research and I think it was like 2 to 3 years and you can get your certification. Sometimes it was 1 year. So I invite you to do research on the different types of certifications if you're interested in that route. So this one might be a little bit harder to get into because they do want complex case management usually already. So it's one of those where they want experience already, but they will take you if you don't. They usually want like 4 years of RN license experience already, and you need to be really good at communicating because you're going to be that liaison between everyone, figuring out what they need, what your patient wants, and how you can support them in that area. So the next role is utilization review. I don't know if you've ever heard of this, but I definitely haven't until I started looking more into remote nursing jobs, and then this role kept coming up time and time again over the last couple of years. So I got curious. I've talked to different nurses that have pursued this pathway, and it is really interesting. So pretty much you're evaluating the patient's care plan to make sure it's effective, efficient, and meets the evidence-based standards. So you're usually actually employed by the hospitals, the health insurance companies, and other medical providers. So there's different ways that you can get into utilization review. I'm also going to start calling this UR. That's the acronym for it, or UM, utilization management, is the umbrella term for UR. So UR nurses review medical records to assess for appropriateness, effectiveness, and timing of the treatments. Does it make sense that they're doing this? Is this going to help them? Or are we just wasting our time? They're evaluating the treatment plans and making sure that they align with the guidelines and protocols of the hospital. So a lot of it is making sure that it makes sense and that we're not wasting time, we're not wasting manpower, and that we're also supporting the patient. And if we're not, UR nurses recommend alternative care, and they may determine that a procedure isn't medically necessary, but they may know of another evidence-based way to support that patient instead, and they may offer that instead. They also communicate with health insurance companies if they aren't already within the health insurance company to make sure that things are covered, or if not, if there's another way that we can cover them. They write reports and evaluate criteria needed to approve treatments, so that prior authorization, and they make recommendations to improve the overall treatment area. So, like I said, UR is a part of that larger umbrella term called UM. And UM just makes sure the patient care is medically necessary and cost efficient. So if you've ever been denied something for health insurance, that's UM and UR. So a little bit contentious there. It can occur before, during, or after a clinical encounter. So the requirements for UM or UR is you need a strong clinical skill and clinical expertise, because you need to understand the medical aspects of relevant information and compare them to insurance regulations. So you also have to understand insurance regulations. As a UM nurse, you must know the knowledge and expertise to evaluate the medical records, the treatment plans, and patient outcomes. You have to be familiar with current evidence-based practices, which is totally our bread and butter, and have experience working in acute care usually, if that's your vibe. You have to be able to analyze data and provide reports for specific areas of improvement. So this might be good if you're like a science-based nurse, if that's your vibe. You have to be a really strong communicator to advocate for your patient. And if you're advocating a different route, why? Where is the evidence and what is your rationale for that? Which is what a lot of nurses do already. I've said before that you have to have the understanding of the regulations and guidelines of the healthcare system, especially for insurance reimbursements, because that helps UM nurses make educated decisions for organizational compliance and really supports the patient and their insurance company. So UM definitely takes a certain type of brain and a certain type of profile, but I think it's really important to mention that. So the next remote nurse writing role, the next remote role for nurses is health coaching. A health coach is a registered nurse who helps patients improve their health and wellness by providing guidance and support. So we're not diagnosing people, we're implementing care plans. So we're doing what we would do in a healthcare facility anyways, but we're just doing it in an outpatient setting, and we're doing it remotely. So we're providing education through wellness coaching theories and patient-centered care model to educate patients and help them take charge of their health. So that might be like really motivating them or providing context to why their doctor recommended certain lifetime changes. We're also providing goal setting for them so that they can identify health concerns, set appropriate goals, and develop strategies so that they can make progress towards those goals. And we also promote lifestyle changes that meet their unique needs, such as like dietary, emotional, and physical goals, whatever they need for their specific treatment plan that has been recommended to them. We're also strong advocates for their patients and helping them understand their health needs. So again, nurse health coaches don't provide medical advice or treat medical conditions. Instead, they use their medical knowledge and wellness understanding to help patients achieve their health goals. So it's a little bit different. They can help patients in a bunch of different ways. They can help them develop a diet plan and covering self-limiting beliefs, track a patient's progress long-term, and motivate patients to change their habits. So you can work for yourself or a larger company. It really depends what you want to do there. There are some certifications, but you don't really quite need a certification because you already have this knowledge, but sometimes it makes yourself more marketable. That being said, there's not really a governing body for health coaching. I've seen Mayo Clinic health coaches before. The American Holistic Nurses Association offers 2 credentials for health nurse coaching. The first one is just nurse coach for nurses who don't have a holistic nursing certification, and the other one is for nurses that are holistically certified. This role might be really good for nurses who love cheering their patients on, especially patients in a more lighthearted outpatient setting, and really watching their patients progress, but don't want that clinical burden anymore. So health coaching might be a really good step for you. So now that we figured out a whole bunch of different ways that we can work remotely, what are some of the steps that we can take to support that journey? So the very first thing you need to do is update your resume. And I know that this is super boring. If you're unfamiliar with resume writing, I suggest you work with a resume writer. There are some nurses that are particularly specialized in resume writing, and they can really help you. Make sure everything is current and tweak it for the role that you want, especially if you're moving away from the bedside role, which is what we would be doing here. I always recommend setting up a LinkedIn profile for remote work. That's how I got started as a medical writer. I set up a LinkedIn profile and the rest is absolutely history. You can network to find availability and opportunity. You can figure out if different remote writing or remote work options are suitable for your lifestyle, and you can see what your options are just in general. If you're a little bit lost, you can also use a career coach. I coach people in medical writing. There's also people that are specific for resume writing. And then there's overall career coaches if you're not quite sure how to make those specific steps happen. I also always recommend just starting to network with people, which sounds really weird as a term, but basically you're just reaching out and building connections, just being a little bit friendly, introducing yourself, who you are, what you're interested in, and you're learning about different people and what they think of their remote options. Do they miss the bedside? Do they like being remote? That type of thing. So just be friendly, go to job fairs in particular areas. I know there's medical writing job fairs and conferences that I've been to just to chat with people, especially in life sciences, and it was really interesting. I've gained some really fascinating insights on nurses in particular in remote work and how we're viewed by the broader community. That was really great for boosting my morale, especially with imposter syndrome. So, and also keep your ears open for opportunities at your specific facility too. You never know what's bopping around, especially if you're at a research facility. There might be clinical trials there already and they might need like a medical writer. So really make sure that you're being dynamic and just keeping your ears open. If you're not ready to take the transition, you don't have to start today, but if you're just starting to introduce this idea, start to pay attention to your surroundings and pay attention to who is already in those roles and where you might be able to find those roles in case you decide that this is the right choice for you. Know what role you might be interested in and see if there's a certification and see if the cert holds weight. If there is a certification, do you need working experience first? Is there a certain certification that's better than others? Start thinking about that. It's never too early. There are certain challenges that come with remote work, like remote technology, dealing with being by yourself and not having an IT team, having to troubleshoot those different types of areas, having slow internet, and concerns for isolation without your peers. So be ready to address those too when you make the transition. I always recommend for isolation joining online communities. I've said it like 18 times, but join LinkedIn. Add me, Janelle McSwiggan. I will be so friendly and so ready to welcome you and also introduce you to my peers who are remote nurses that are rocking it on LinkedIn. Make sure you have hobbies set up too that get you outside of the house. I have a circus gym that I go to for at least an hour every day. I have friends there. I go skiing on the weekend. I have dinner parties. I am super active in my community. So make sure that you have something like that going on too to combat that isolation. And prepare yourself for the digital transformation. So make sure that your computer and your internet are up to date. I started off with a really slow computer and I made it work, but I upgraded pretty soon after. So make sure that you have like a computer that works and an internet that support remote work. And if you run into hiccups, reach out to your boss immediately and let him know of any tech concerns. If you have a team that can support you, don't do it by yourself. So I know that this was a banging episode, but there are so many options in remote work. So I think it's really So I think it's really important to introduce the main concepts because we're going to be tackling these themes time and time again. So this is your first taste of some of these new ventures that you can start to go into, but we're going to be diving in with expert interviews and everything else in the next coming episodes. So you can decide if you want to own your own business and be a medical writer or an LNC, or if you want a more traditional remote role like UM or UR. Either way, there's tons of different options for you, and you are going to be welcomed as a remote worker. You do not have to stay at the bedside if you don't want to be at the bedside. There are tons of different ways that you can use your remote nursing license. You just have to figure out what works for you and how to get there, which is exactly what we're going to be doing in the duration of this podcast. Make sure you reach out to me on LinkedIn if you're interested. I also have TikTok, Instagram, and YouTube if you get media in your different ways. Thank you for joining me.